I've ever been to in my life. But I've never been as informed in such an interesting way than by the skit that your three presenters just provided to all of us. And so I want to say again, to thank you to the three gentlemen who did what I think is a really fine representation of some of the issues that are facing us. And it reminds us when we talk and when we use words and when we throw out concepts that sometimes we're thinking that people understand what we're talking about and they actually don't. Healthcare is one of those fields that has lots of initials, the ABC and the FQZ and the DAS and the DOH and the blah, blah, blah. And sometimes we talk in shorthand. And if we do, somebody please just throw up your hand and call us on it. Because we talk to each other a lot and we forget and slip back into our little in-house language. One of the things that struck me most about the presentation that we just experienced and listening to your perceptions of what's going on, especially coming out of the May 16th meeting, was an understanding of the concept of merger. And I think you said merger was either you consolidate to save money and you were concerned about the services. Well, I want to assure everyone in this room that all of us from the interfaith side are equally concerned about what the future of the hospital and the entire health delivery system in this community would look like as we move forward and look with our sister facilities, Brooklyn Hospital and Wyckoff Medical Center, at how we can not so much save money, but how we can improve the delivery of basic health care in our community. The first thing that I would hope to stress for everyone is hospitals don't equal health care. We are working trying to inform our community and everyone that will listen to us that we need good, basic, first-level health care so that our emergency room and Dr. Ajari and all his staff, that's not the first line of interaction with us, and that the emergency room is not our front door, and working through the federally qualified health centers, freestanding doctor's offices, and looking at all the resources in our community, how interfaith then serves as an adjunct and a support to all of those so that we have a healthy community. People come to us when they are really, really sick. They have waited too long. They haven't gone for checkups, and then they try to enter into our emergency department, and we'd like to see people either in our clinics or other programs that we hope to establish so that we can begin to have a much healthier community. We also are very concerned and will be exploring with our sister facilities what services are should best remain at 1545 Atlantic Avenue based on the health needs of our community. We have studies after studies and stacks of studies built on work done by the New York City Health Department, and another one of those things that has funny initials, BHIP, Brooklyn Health Improvement Program. And what they have done, and one of these, is study hotspots in the community where medical care is lacking. So we're working on analyses of this. I'm getting trying to be quiet. But what I want you to know is that before we can even begin to entertain the notions of mergers or closings or ending departments, the decisions will be based on what are the primary health needs of the people of this community and how we best serve them. So with that, I will now turn over my microphone to our President and CEO.
I just want to remind the panelists that we are under time constraints. The sanctuary was given to us at a appointed time, and we really want to be out here. We want everyone to have a chance to express themselves. We also have someone who had a family member that was a patient at Interfaith. So I want to get not only the CEO's perspective, but the outpatient, patient care. So let's be conscious of the time. Thank you.
Again, I echo the words of Ms. Karen Porter. And thank you for inviting us to this forum and giving us the opportunity to share with you what's going on at Interfaith Medical Center. I've always believed in schools or hospitals, any services that are provided to the community, the more involved the community, the better the services will be. Because a lot of times, us as administrators or us as providers, we try to provide the services, but you are the ones who are measuring the services. And if you don't get that feedback to us, a lot of times we think we're doing a good job, perhaps we're not. So I always welcome constructive criticism and ways that we can better ourselves. And our goal is to provide the best services that we can provide to this community. That's our goal. One of the other goals that we have had as support of the board is that this hospital will remain open. I believe we've been here since 1856. I believe it's the original date somewhere. That's been a long time. I definitely was not around at that time. But our goal is to be here at least another 100 years. Again, I do not plan to be committing to extend my contract that long. But our goal is that this community and the future generations would also be served by Interfaith Medical Center. One of the things that has significantly changed over the years, and I previously have mentioned this at the last meeting that we had, predominantly the reason why we find ourselves in this position today is predominantly financial. And basically was as a result the changes in reimbursement that occurred was implemented in March of 2010, retroactive back to November of 2009. And from that period of time, we find ourselves that the service that we're providing, we're not able to capture sufficient revenues to pay the cost that it needs to. We have approximately $200 million budget, of which about 64% is spent in salaries and benefits. So any time that we need to make significant changes, you could change in any way you want, but ultimately you're going to have to probably affect those areas because that's the majority of the money goes in those areas. So yes, we did have some reductions of staff, but I can assure you that at no time did we reduce the staff to the point that patient care is compromised. Now, I'm not going to say that there aren't any times where we are short-staffed, but that's not so indicative of the staffing levels. It's indicative because sometimes people take off, it's hard to find a replacement, etc. I guess I have 2 minutes left. But the other point that I wanted to emphasize is that starting tomorrow is going to be the kickoff meeting with a consultant that we have retained. And the purpose of this next 12 to 14 weeks is to conduct the analysis, to look at the 3 institutions and see how we can combine these three institutions, what services, etc., will be best to serve. Our goal, again, is that we will be a full-service hospital to this community. And that means at the present time we're providing medical surgical services, we're providing pediatric services, and we're providing behavioral health services. And our goal is to continue to provide those services. Now, I do understand that there has to be some reductions. I guess 1 minute left.
No minutes.
I'll just give you one quick example. At the present time, there's 3 CEOs. I foresee in the near future, if we do have a merger, that there will probably only be 1. So I will probably be the one that's mostly affected. Thank you.
Thank you. Keep in mind of your time, please.
Okay, before you continue, may I interrupt for a minute? Just for 1 minute.
Cut all the cell phones.
I have these cards. We're under time constraint, so if you have a question, please raise your hand. I'll bring you the card. You write the question on the card, and we will try our best to answer those questions for you, okay? Thank you so much.
You want me to hold on to the council?
Thank you very much for asking us to come. I'm very impressed, quarter to 8, there's so many people from the community who are here to support the hospital. I am Chief Medical Officer at Interfaith. I joined in July of 2010. As Mr. Hernandez said, that the reason we are having some issues right now is because we got cut in the Medicaid reimbursement. Hospital was doing fine. I joined, and the idea was, when I came here from other hospital, my plan was to bring in new programs. We don't have a stroke center, we don't have a chest pain observation unit. There are quite a few things that community needs for a acute care institution. We are not a university hospital from that point of view, even though we have a very, very good teaching programs. And one of my aim is to establish those doctors who are graduating from here into the community, so you have more private doctors here. Then you don't have to run to Manhattan or some other place to see a private doctor, which is part of the education process that we need to have. We see those trained people, the pass rate in the boards which are given nationally is 100% from this program. This is an institution that you all know. Brooklyn Jewish was a very good academic institution before, wrote a lot of papers, books, and was very well known nationally, internationally. We are the same people there, the same program. We just have, because of the financial issues that happened with the institution, because of the reimbursement in the Medicaid is so small, institutions struggle with that. But it is, the quality is there. We are working as a new chairman in the emergency department. My main aim is to improve patient care so that we are at level with every other hospital there or even better. Education-wise, I guarantee you, we are better than any hospital. Okay? There are very few hospitals that can claim 100% pass rate in the boards, and we don't have like 2 or 3 residents. We have 85 residents, 3 fellowship programs. Okay, so basically you are saying it's a full functional hospital. We don't have OB, I understand that part, but as you come to the emergency room, we'll take care of what we cannot do, we transfer, which is this is the way we do. So again, I will save you some time. So we are here, and I'm very impressed with the show that you were putting. The skit was wonderful. Thank you. And I think I'll stop here. So say you 2 minutes for the next speaker.
Don't be shy.
Somebody dropped their keys under the table.
Can you say what your name too?
I'm Samuel Ajari, and I'm the chairman to the emergency department. Once again, I'd like to thank this community for initiating this bill to the governor to actually keep Interfaith open. You are asking for your fair share of the cake. There is a very important statistic that I heard one of our congressmen New York area, a hospital serves about 40,000 people. You look at our area, it's slated at about 120,000 people per hospital. You look at the various diseases, and we have quite a case mix in this neighborhood. And there is no reason why they should take away services. There's no reason why they should require you to travel across the bridge to seek health care if it is right here in the neighborhood. I joined the hospital about a year ago, and we are doing our very best to make sure that we provide excellent care to the community. We realize a few defects, and we're trying and working hard to correct them. We want to make sure that you're turned around as quickly as possible. You're not left waiting in the emergency rooms. We want to make sure that we make the right decisions to either treat and release you, treat and book you.